What if I told you that your heart might be working too hard and you don't even know it? After 60, your safe heart rate range changes, and crossing one specific number could put serious stress on your heart. Today, we'll reveal the exact limit most seniors don't know and how to stay in the safe zone. Maximum heart rate is the fastest rate at which the heart can safely beat during intense physical effort. And one of the most important physiological changes that occurs with aging is a gradual decline in this upper limit. The heart is a muscle, and like all muscles in the body, its performance characteristics evolve over time. Structural changes occur in the cardiovascular system with age. The heart walls may thicken slightly, the chambers can become less flexible, and the electrical conduction system that controls rhythm may not fire as rapidly as it did in youth. These changes do not mean the heart becomes weak, but they do mean it responds differently to physical stress. Exercise science commonly uses a simple estimation formula, 220 minus age. While this does not perfectly predict every individual's true maximum, it provides a practical guideline for understanding how aging shifts cardiovascular capacity. For example, a 30-year-old might have an estimated max heart rate around 190 beats per minute, whereas a 65-year-old may be closer to 155. That difference represents a significant reduction in how fast the heart is designed to beat under peak strain. Pushing far beyond this age-adjusted ceiling can increase cardiac workload without providing extra benefit, especially in individuals with underlying risk factors such as high blood pressure or arterial stiffness. One key reason for this decline is reduced responsiveness to adrenaline and other stimulatory hormones. In younger adults, these hormones rapidly increase heart rate and contractility during exertion. With age, receptor sensitivity decreases, so the heart cannot accelerate as dramatically. At the same time, blood vessels may become less elastic, meaning the heart must pump against slightly greater resistance. When the heart beats extremely fast under these conditions, filling time between beats shortens, which can reduce how efficiently blood is delivered to the body and to the heart muscle itself. Another factor is changes in the heart's natural pacemaker cells. The number of these specialized cells gradually decreases over the decades, contributing to a lower achievable peak rate. This is a normal biological process, not a disease. It reflects a shift from a system built for explosive performance toward one optimized for efficiency and endurance. For seniors, this means the cardiovascular system often responds best to steady, moderate effort rather than sudden maximal bursts. Understanding this decline helps reframe exercise goals after 60. The objective is not to chase numbers associated with youth, but to work within a safe physiological range that strengthens the heart without overwhelming it. When older adults repeatedly push near their theoretical maximum, recovery demands increase, blood pressure spikes can be more pronounced, and the risk of rhythm disturbances may rise, particularly in those who are deconditioned. Training slightly below the upper limit allows the heart to adapt by improving stroke volume, circulation, and oxygen delivery while minimizing excessive strain on cardiac tissues and blood vessels. While maximum heart rate tells us about the heart under stress, resting heart rate reveals how efficiently it functions during everyday life. Resting heart rate, RHR, is the number of times the heart beats per minute when the body is calm, relaxed, and not under physical or emotional strain. For most healthy adults over 60, a typical resting heart rate falls between 60 to 80 beats per minute. Though well-conditioned individuals may naturally sit slightly lower, what matters most is not chasing the lowest possible number, but understanding what your personal baseline says about your heart's workload. The heart's main job is to pump oxygen-rich blood to tissues. A lower resting heart rate often means the heart pumps more blood with each beat, higher stroke volume, so it doesn't need to beat as frequently to meet the body's needs. This efficiency is strongly associated with cardiovascular fitness. Regular aerobic and resistance training strengthen the heart muscle, improve circulation, and enhance oxygen delivery. Over time, this allows the heart to do the same job with less effort, which is one reason physically active seniors often show lower resting heart rates compared to sedentary peers. On the other hand, a consistently elevated resting heart rate, especially above 80-85 beats per minute, can signal that the heart is working harder than necessary. This may be linked to low fitness levels, dehydration, stress, poor sleep, anemia, thyroid imbalance, or underlying cardiovascular strain. Each extra beat represents additional mechanical work for the heart over the course of the day. Multiply that by thousands of beats, and the long-term load becomes significant. Research has associated higher resting heart rates with increased risk of heart disease, stroke, and overall mortality, making RHR a simple but meaningful marker to monitor. Aging itself influences resting heart rate through changes in the nervous system. The balance between the sympathetic, fight or flight, and parasympathetic, rest and digest, systems can shift, sometimes leading to a slightly higher baseline pulse. Chronic stress, common in modern life, keeps the sympathetic system more active, preventing the heart from fully relaxing. Exercise, deep breathing, adequate sleep, and proper hydration all support parasympathetic activity, helping bring resting heart rate into a healthier range. Measurement consistency is crucial. The best time to check resting heart rate is first thing in the morning, before getting out of bed. Tracking it over weeks provides more insight than a single reading. A gradual downward trend often reflects improved fitness, while sudden unexplained increases may indicate illness, overtraining, or systemic stress. For seniors, the goal is a stable, moderate resting heart rate paired with good energy levels, comfortable breathing, and the ability to perform daily activities without excessive fatigue. This reflects a heart that is not just beating, but working efficiently, supporting circulation, brain function, and metabolic health in a way that promotes longevity and functional independence. After 60, one of the most important indicators of heart health is not just how fast the heart beats, but how appropriately it responds to physical activity and how efficiently it recovers afterward. Many people focus only on a single maximum number, but the real story lies in how smoothly the cardiovascular system adapts to effort. A healthy heart should increase its rate gradually as activity begins, sustain a safe level during movement, and then return toward normal within a reasonable time after stopping. This adaptability reflects strong communication between the heart, blood vessels, muscles, and nervous system. When you start walking, climbing stairs, or doing resistance exercises, your muscles demand more oxygen. In response, the nervous system signals the heart to beat faster and stronger. For older adults, this increase should feel proportional to the activity. Light effort should cause a mild rise in breathing and pulse, while moderate effort should make conversation possible but slightly challenging. If heart rate spikes rapidly with very small effort, or if you feel dizzy, extremely breathless, or experience chest discomfort, it may indicate that the cardiovascular system is under strain or deconditioned. Equally important is recovery heart rate, how quickly the pulse drops after exercise stops. This is a powerful measure of cardiac efficiency and nervous system balance. After moderate activity, the heart rate should begin decreasing within the first minute of rest. A drop of around 12 beats or more in the first minute is often considered a sign of healthier autonomic function. Slow recovery can suggest low fitness, high stress load, or cardiovascular inefficiency. Over time, regular training improves this response because the heart becomes stronger and the parasympathetic nervous system becomes more active. Allowing the body to shift smoothly from activity mode back to rest mode, aging can blunt this responsiveness due to reduced elasticity of blood vessels, changes in nerve signaling, and decreased aerobic capacity. However, these changes are not fixed. Consistent aerobic exercise such as brisk walking, cycling, or swimming, combined with resistance training, improves how effectively the heart pumps and how well blood vessels dilate. This leads to better oxygen delivery, lower effort at the same workload, and a more controlled rise in heart rate during movement. Monitoring perceived exertion alongside heart rate is especially useful for seniors. Instead of chasing high numbers, aim for a level where breathing is deeper but controlled, posture remains stable, and movement quality stays strong. This zone stimulates the heart safely without excessive strain. Over weeks and months, you may notice that the same activity produces a lower heart rate than before, which signals improved efficiency. A well-functioning heart is not defined by extremes, but by flexibility, the ability to rise to meet physical demands and then return calmly to baseline, supporting endurance, safety, and independence in daily life. While heart rate numbers are useful guidelines, they cannot tell the whole story, especially for adults over 60. A pulse that seems fast may be normal in some contexts, but when accompanied by certain symptoms, it can signal that the heart is under undue stress. Seniors often rely solely on devices or formulas like 220 minus age, but ignoring how the body feels can be risky. The key is to observe both the heart rate and any physical signals that may indicate strain. The most important warning signs include chest pressure or tightness, unusual shortness of breath, lightheadedness or dizziness, and sudden fatigue that seems out of proportion to the activity. Experiencing these while performing even light tasks, such as walking around the house, climbing a few stairs, or doing gentle exercises, suggests that the heart is working harder than it safely should. Rapid heartbeat at rest without any recent activity is another indicator that something may be off. These are not just numbers going up. They are real physiological responses showing that the heart is under stress, either from cardiovascular inefficiency, dehydration, electrolyte imbalance, or other underlying conditions. It is also important to recognize patterns. If symptoms occur repeatedly in similar situations, or if they appear alongside consistently elevated resting heart rates, they are likely meaningful. Temporary spikes in heart rate during a brisk walk are expected, but a persistent racing pulse paired with discomfort is a signal to slow down, rest, or seek medical assessment. Ignoring these signals can lead to increased cardiac strain and, over time, raise the risk of arrhythmias, high blood pressure complications, or other cardiovascular events. Seniors should also consider factors that influence heart response, such as medication effects, caffeine intake, stress, and overall hydration. Even small changes in daily routine can affect heart rhythm and perceived exertion. Regular monitoring, combined with attention to how the body feels, empowers older adults to exercise safely. This approach aligns with modern cardiac rehabilitation practices, which emphasize both heart rate monitoring and symptom awareness. Education around these warning signs is critical. Many seniors assume that fast is bad or numbers alone define risk, but real-world experience shows that the body's signals often arrive before a number reaches a dangerous threshold. By learning to recognize and respect these signals, older adults can maintain independence, continue safe activity, and reduce unnecessary stress on the heart. Emphasizing symptoms over pure numbers also helps avoid fear-driven overcautiousness, encouraging seniors to remain active while staying within safe physiological limits. After 60, one of the most important principles of heart health is understanding that the goal is not extreme effort, but consistent, moderate activity. Many seniors assume that only vigorous exercise strengthens the heart, but research in cardiac rehabilitation practices show that regular controlled movement provides far greater benefits while minimizing risk. The aging heart responds best to steady challenges rather than sudden bursts of intensity that can spike blood pressure or stress cardiac tissue. The most protective forms of exercise for older adults include brisk walking, chair exercises, light resistance training, and controlled breathing movements. These activities are safe, sustainable, and effective for improving heart efficiency. Brisk walking, for instance, gently elevates the heart rate into a moderate training zone, stimulating circulation, improving oxygen delivery, and supporting vascular health. Chair exercises allow seniors with limited mobility to activate muscles, promote blood flow, and maintain joint flexibility, all while keeping the heart rate within safe limits. Light resistance training strengthens muscles without overloading the cardiovascular system, which is especially important because muscle mass naturally declines with age, influencing metabolism and heart workload. Controlled breathing and movement exercises help regulate the autonomic nervous system, reducing stress-induced spikes in heart rate and improving recovery after activity. Consistency, more than intensity, allows the heart to adapt gradually. Over time, regular movement improves stroke volume, the amount of blood pumped per beat, which means the heart can circulate blood efficiently with fewer beats. This reduces cumulative stress on cardiac tissue and helps maintain blood pressure within healthy ranges. When the heart works efficiently, seniors can perform daily tasks comfortably, maintain energy levels, and reduce fatigue. Over time, consistent moderate activity also improves recovery heart rate, allowing the pulse to return to baseline quickly after exertion, which is a powerful marker of cardiovascular fitness and autonomic balance. Another advantage of moderate regular exercise is safety. High-intensity workouts can increase the risk of rhythm disturbances, joint injuries, and fatigue in older adults, particularly those with underlying conditions. By focusing on safe, repeatable movements, seniors not only strengthen the heart but also build confidence and create sustainable habits. This approach aligns with medical recommendations for cardiac rehabilitation, emphasizing progress, safety, and measurable improvements rather than short-term extremes. Ultimately, the key message is that the aging heart thrives on rhythm and routine, not extremes. Small, consistent efforts add up to major cardiovascular benefits over months and years. Seniors who commit to daily movement, even in short intervals, can improve heart efficiency, support circulation, and maintain independence and vitality. The emphasis should always be on gradual adaptation, listening to body signals, and keeping the heart within a comfortable and effective training zone. A simple guiding principle encapsulates this idea perfectly. After 60, the goal isn't to push your heart to its limit. It's to train it to work efficiently. This mindset ensures seniors prioritize long-term heart health, safety, and functional fitness, creating a sustainable foundation for a strong cardiovascular system and higher quality of life.